Pediatrics involves the whole community. We're all in it together. The families, the doctors, the pediatricians, we all have to work together to affect a positive outcome for any sick child. So my goal was to get the pediatricians involved, engaged, to find out what their need was in the community, and to use the hospital as a resource for that. The local physicians, pediatricians, are very engaged with their patients. They want the best quality care, but they can't always take care of the patients in the hospital setting. We specialize in that delivery of that kind of care. So as a pediatrician in the community, you're doing more preventative care, and we do more of the acute illness care. One thing that we excel on in our practice is we are the pediatricians in the emergency room as well. When we see a patient in the emergency room, we are also the admitting physician for that patient on the pediatric floor. So it ensures great continuity of care. The same family will be dealing with the same pediatrician for at least 24-hour period of time. In addition to that, we feel that treating a pediatric patient, you have to treat the family as well. So we have specific suites for families. We call them suites as opposed to hospital rooms, where we have separate TVs, for example, one for the parents, one for the child, because it's so important to treat the family as a whole entity. Pediatric patients aren't small adults. That's often a major misconception. Although pediatric EM doctors are well trained in pediatrics, we tend to understand the subtleties a little bit better. The developmental aspects of pediatric care, the little nuances, the different organisms that attack children at different ages, the way children respond to illnesses depending on their developmental stage. And also we have some development challenged patients as well, which they don't see a lot of. So we have the advantage in knowing those nuances. In addition, we speak the same language as the pediatricians do. So when we call a pediatrician to let them know how their patient is doing, we tend to have better communication in that respect.